The World Heart Day is commemorated every 29th September annually to raise awareness on the need for a healthy heart. The theme for this year's commemoration is Harnessing the Power of Digital Health to Improve Awareness, Prevention, and Management of Cardiovascular Diseases globally. According to the World Health Organization, 32% of all global deaths are attributed to cardiovascular diseases, and trans fat is linked to cardiovascular diseases. With poor awareness in Nigeria on the health risks associated with trans fatty acids intake, how best can this ugly trend be addressed? This will form the thrust of our interview segment on Environment Today.
So, looking at this year's theme for the World Heart Day, harnessing the power of digital health to improve awareness, prevention, and management of cardiovascular diseases globally. You know, we talked about telehealth. So, I want to know, which has a huge role to play as we continue to use the heartbeat and all. So, how well is Nigeria doing in terms of telehealth,
Okay.
as it relates to nutrition?
Okay, telehealth.
Or maybe you want to help us with what telehealth
I think
means, first of all.
telehealth. Yeah, I think is something that is coming up, and that telehealth is about using all these electronic or digital means of delivering healthcare services to clients or to patients, to everybody that require the services. And it involves the use of ICT. Of course, the world is fast moving, in terms of ICT. So that's why when we look at the health services that are being provided, you find that putting ICT as a tool to deliver will make a significant improvement in the services that are provided. So, for example, if I may take it, we are talking of creating awareness, okay, as one of the major ways to get people to understand how detrimental the consumption of trans fat is. So if we were able to push messages through the telecom service provider, we used to get all these, what do you call them, unsolicited messages, for example. If you can instead have a regulation to say that you want them to be using all those unsolicited, to just pass across a message to say, to remind you about trans fat consumption, that how much of trans fat they consume, or trans fat is detrimental. Just those simple messages to your health. It is input ABC, just to give you examples. And that will reach how many millions of people in a minute, in even fraction of seconds sometimes. And that's a good way of using now ICT.
I want to know, beyond junk food,
Yes.
what other food can we eat to help improve our heart's health?
Improve heart health. Okay, you say beyond junk food. The junk foods are not helping heart health.
They're not helpful.
Yeah,
That's what
the
I'm
junk,
saying.
yes.
Outside them now.
Yes.
Because they're not healthy.
Yes.
So what should we eat?
Yeah, I've already mentioned this. If you go for fruits and vegetables, you expect to eat at least 400 grams of fruits and vegetables in a day. That's the five serving. Yes, you're expected to be consuming whole grain cereals. You're expected, like I've said, to lessen your salt consumption. You're expected to take some other classes of food. The most important thing here that I mentioned, to cut it short, is diversification. In terms of what you need to eat, there is what we call diet diversity. So try to see that every day you consume a little bit of each of the classes of food. We all know we have carbohydrate, we have fat, we have protein, we have the fruits, we have the vegetable tubers. In a day, try to see, okay, how many classes of food did I consume? So that one counts a lot in how adequate you are going to get.
Okay, so the youths who are also vulnerable to heart-related ailments, what do you say to them?
Yes, I think that's category of people that we really need to work on, because all this issue we are talking about to create awareness on is about changing behavior of people, and it's very difficult, and you have to do it persistently before you succeed. So for youth in particular, if you look at the trend nowadays, like I've said, we are now seeing a lot of junk foods everywhere. Every day we see new joint, open for junk food in most of our cities, and even including our towns and even villages. Of course, things like suya has been there for long, and And then nowadays we are getting them transformed to all these fast food services. For younger people, you will see that this consumption of junk food, I don't know of any research that has checked whether based on age group, but certainly that group of people are the ones that are more at risk based on this consumption of. Normally, according to WHO, people 30 years to about 69 are those at higher risk. But you see now younger people are getting all this heart attack. You see young people having hypertension, for example, because they are now the ones that are mainly patronizing these junk foods, and also the issue of these sugary drinks. If I take Kano, for example, where I know most, you find most of the small shops that we normally see on the streets are being transformed to drinks joints or drinks trades, and every day you are seeing new product that of the sugar sweetened drinks that are just delivering too much sugar that can affect the health of these young people, in addition to all these junk foods. So most of the food they consume within that class, junk and this. So I think the best thing is to see how best we can include nutrition education in our schools. That's for those category of people. So that as long as sometimes if you take something in school, people will just take it just for exam and pass it. And that's why it may have to go beyond the school. You have to find the ways, like this campaign we are talking about. We have to take ways to have campaigns, and ways also. That's why the use of these tele service is very important, because for that class of individuals, it's easier way to reach them. And once you can make it either as drama, as whatever, gradually you may tend to change the process. And also another way is, in some countries, you find that the government tried to put tax on those things. So the tax will be higher, okay, and those things will be expensive. But then once people are addicted to it, it's difficult, no matter how expensive, they will still go for it. And these governments, sorry to say, there is this issue of politics in issue of what we eat, or nutrition, if I may take it like that, because sometimes it's painful that we know this is bad, but we allow it simply because on the side of government is about the tax that we get from the companies. So if I can get tax from you, I don't care whatever it is, because that's the tax that I need from my government. In the part of companies, all they care is their profit. So it's issue profit and tax now, putting the consumer in between. So whatever, they don't care. So one is just pulling the profit, the other is pulling the tax, and you are at the middle. So if I may take very simple example, this cigarette smoking, which is also part of the contributors to heart diseases. Of course, we are not talking of other factors, we are taking on food. But I'm giving that as example because you see, every day, in fact, in the advert, people will be told cigarette smokers are liable to what? To die young. Well, if we know that, why not say, okay, just stop cigarette? Simple. The WHO or whatever it is, the governments that are responsible for the lives of the people.